Hello, Dr. Gauri. You can start.
Okay, Dr. Jaiswal. Good evening to everyone. Today we are having the second session of Shalakya, second pre-session of Shalakya. We are planning to have launch sessions for every subjects. Initially we have started with Shalakya. We are also doing it on Shalya, R&B, Prasuti, KC, and Panchakarma. So it is like each day we have scheduled for each subject. So first two sessions for every subject we are giving as free sessions for promotion. So you can join all these sessions and you can just see how the sessions are going on. And it will be academic sessions, purely academic sessions as per the syllabus. So what we are actually aiming is the first year PG students as well as the UG students. And the syllabus are started in such a way that both of these students can be benefited from it. We'll be also circulating the syllabus through all groups and also the days of each session. So you can go through the same, and if found useful, it will be a very helpful session for especially for preparing for your exams, especially for those who are going to attend your exams in the month of October and November. We are planning to have 25 sessions for each subject, and it will be actually taught by very experienced faculties who are specialized in the concerned subject. And we are planning 25 sessions for each subject and covering almost all the points of the syllabus. We will be also giving printed notes for each of these the syllabus points. It will be given to you at the time just after the classes or just before the class. We will be circulating the notes. So it will be in printed format, so that you will be like very much prepared for your exam. So by October, we are planning to wind up the classes to cover up all these 25 sessions. We have this for Shalakya, this is the second session. Shalya, one session it is over. R&B, one session it is over. Tomorrow, we are going to have a session on Prasudi and Sriloka. On Monday, we are going to have a session, the first session of Panchakarma. And on Tuesday, we are going to have the session on Kai Chikalsa. So this is the schedule. And Thursdays are for Shalya, Fridays are for Rasashastra and Bhaishya Kalpana. This is the weekly schedule of each subject. So you can attend these classes, and it will be of great help to you, especially during these COVID times. It will be a great help to you for preparing for your exams. So today we are going to have the second session of Shalakya, and it will be taken by Dr. Ashwin. He's the assistant professor in Ashtanga Ayurveda College. Dr. Ashwin, you can start the session. Thank you so much.
Hello. Hello, Dr. Gauri.
Yeah, doctor, you can.
Okay.
Continue.
Yes. Okay.
Yeah, ready.
Okay. So PPT is visible, Dr. Jaiswal?
Yeah, visible.
Okay. Ajnana Timirandasya Jnananjana Shalakaya Chakshurunmilitam Yena Tasmai Sri Gurave Namah. Good evening, one and all. Myself, Dr. Ashwin, working as assistant professor and consultant in the Department of Shalakya Tantra at Ashtanga Ayurveda Chikitsalayam Vidyapitham Palakkad. Before starting the session, I would like to thank the entire group of Ayurveda MAP, especially Dr. Jaiswal and Dr. Gauri for giving me such an opportunity. Today, I'm going to deal the Kriya Kalpas in Shalakya Tantra. As you all know that the Kriya Kalpas in Shalakya Tantra is very it's a big topic. So the entire Kriya Kalpas can be divided into Netra Kriya Kalpas, Karna Kriya Kalpas, Nasa Kriya Kalpas, and Shiro Kriya Kalpas. So I have divided my classes into two sections. Today I am going to take the Netra Kriya Kalpas exclusively. In the next class, I am going to take the Karna Nasa Shiro Kriya Kalpas. Okay. Let us move on to Netra Kriya Kalpas. Okay, before going to the section, let us check out what is Kriya Kalpa. Kriya Kalpa is a single word coming from two words, Kriya and Kalpa. Kriya means to perform or to do a medical treatment. It can be a surgical treatment also. Okay, Kalpa means is feasible, competent method of cure. So in total, Kriya Kalpa means to perform a medical treatment. Okay. Let us check out what all are the Kriya Kalpa mentioned by the Acharyas. This chart shows various Kriya Kalpas mentioned by different Acharyas. You can see the maximum number of Kriya Kalpas mentioned by Acharya Sharangadhara and Bhavapragashvara. What all are they? They are, you can see Sekam, Astodanam Pindi, Vidalas Tarpanam Tata, Pudapago Anjanam Chepi, Kalpaneer Netram Acharet. So Acharya has mentioned Tarpana, Pudapaga, Seka, Astodhana, Anjana, Pindi, Vidalaga type of Netra Kriya Kalpas. In this chart, you can see that Ashtanga Sangragahara has not mentioned Pindi Kriya Kalpa, and Ashtanga Hridayagara has not mentioned the Seka and Pindi type of Kriya Kalpas. But Susarda Acharya has mentioned all Tarpana, Pudapaga, Seka, Astodhana, and Anjana. There is no mentioning of Pindi and Vidalaga in the Susarda Samhita. In Charaka Samhita, we can see Tarpana, Astodhana, Anjana, and Vidalaga type of Netra Kriya Kalpas exclusively. Okay. So this chart is very important. You have to mug up all these data. Okay. There are frequently asked questions from this chart. Okay. It should be frequently asked questions in AJPT exam and all, or competitive exam. This is very important. Okay. So moving on to Ama Netra Lakshana. Before going to each and every Kriya Kalpas, you have to learn Ama Netra Lakshana and Nirama Netra Lakshana. Okay, let us check out what is Ama Netra Lakshana. Udirna Vedanam Netram, Raga Shodha Samanvitam, Karsha Nistoda Shulasru, Yukta Mamanvitam Vidu. It's a reference we can see in the Madhava Nidana 59th sloka, 59th chapter, 12th sloka. Let us check out each and every points of this sloka. Udirana Vedanam. There will be pain in the eyes. Raga Shodha Samanvitam. There will be swelling and redness. Karsha here means foreign body sensation of eye. Nistoda Shulasru. Here, different kinds of eye pain. There will be throbbing pain, pricking type of pain. We can see in Ama Netra Lakshana. Also, there will be watering from the eyes also experienced. Let us check out what all are the procedures can be done in Ama Avastha. The 4 procedures we can do in Ama Avastha. What all are the Sekam, Astodhanam, Pindi, and Vidalaga. In first picture, you can see that one is a Seka. Next picture, you can see the Astodhana. Third picture is the Pindi, and fourth picture is the Vidalaga. Okay. Let us moving on to Nirama Netra Lakshana. Nirama Netra Lakshana, we can have the reference from Madhanidana 59th chapter, 13th sloka. Manda Vedanata Kandu, Sambhram Basur Prashantata, Prasanna Varnata Chakshne, Sampakwa Dosha Madishet. In Sharangadhara also, we can, Yogaraknavara also, we can get this reference. Manda Vedanata Kandu, Sambhram Basur Prashantata, Prasanna Varnada Chakshne, some Niramas Tasya Lakshana. That is some weird difference also there. Okay, let us check out. Manda Vedanata, there will be mild pain is there. Kandu, there will be mild itching, we can see in Nirama Avastha, and Sambhramba Asuru Prashantata. In Ama Avastha, I have told that there is a Asuru Pravarti is there. That Asuru Pravarti is arrested. There will be calmness to eyes experienced by the patient. And Prasanna Varnada Chakshne, there will be clarity in vision observed by the patient. If these all are the symptoms present with the patient, it is said to be Nirama Avastha. Okay, let us check out the procedures can be done in Nirama-avastha. What are they? Tarpana, Anjana, Pudabhaga. Okay, the first one is the Anjana Kriya Kalpa. Second one is the Tarpana, and last one is the Pudabhaga. Okay, before going to the presentation, you have to understand some basic principles of ocular pharmacology. I have included certain points of a few slides regarding principles of ocular pharmacology. Let us check out. To understand Netra Kriya Kalpa, you need to understand these principles of ocular pharmacology. What are they? Routes of administration, complaints, disposal, absorption, drug vehicles, and bioavailability. Okay, let's check out what is route of administration. The route of administration can be of three types. What are they? There may be extraocular type of administration, intraocular, and systemic route of administrations. In extraocular, these are the topical routes of administration. For example, gel, ointments, and solutions are we are applying to the eyes now. It is the extraocular type of administration. In intraocular, this includes subconjunctival injections, retrobulbar injections, intraocular injection. All the anesthetics agents are we are injecting to the eye through this intraocular administration. The third one is the systemic route of administration. Okay, we can see that the conjunctival sac has greater affinity to absorb water and fat molecules. This can be taken in the context of astodhana with both liquid and snehadravya we are pouring to the eyes. So the conjunctival sac, there will be absorption through the conjunctival sac. The subconjunctival injection has the affinity to absorb big size molecules. This can be taken in the context of Anjana Karma, where we are using many rasa aushadhis like antimony sulfate and mercurial compounds are we are using. So there will be absorption mode through the conjunctival sac. Okay, the this systemic absorption, systemic administration is limited. Why? Because there will be presence of blood aqueous, blood vitreous, and other blood retinal barriers. Usually, the drugs which are administered systemically and orally do not cross these barriers, whereas the topically administered medicine have the greater affinity to cross these blood aqueous, blood retinal, and blood vitreous barriers. So the physician, it's a duty of physician to explaining the procedure, each and every time and administration of procedure to patient, and the repeated administration of procedure which reduce the non-compliance and the fixed dosage also prevent its complications. So it is very important to know the compliance of drug delivery. So disposal, regarding disposal can be taken in the context of astodhana karma. Here, after drugs are topically administered into the subconjunctival sac, almost 80% of the drops drains through the nasolacrimal duct, but the volume of liquid that retains for 2 to 3 minutes, there will be absorption more. And astrodhana, we are using small amounts of drugs, so it helps to absorb the drugs more. Regarding absorption and all, the corneal epithelium is lipophilic in nature, but the corneal stroma is hydrophilic nature. So this is what we can think is the drug is to reach the tissues need to pass through the corneal stroma. Okay, in order to make the corneal stroma hydrophilic, the repeated blinking action is required. So this repeated blinking action will help for the distribution of tears on the surface of cornea, becomes the hydrophilic in nature due to the repeated blinking action. This can be taken in the context of tarpana, where we repeated blinking is facilitated. So the absorption is very much important in drug delivery system. So the last part is drug vehicles and bioavailability. What do you mean by drug vehicles? Drug vehicles are the medium through which effective absorption of medicine takes place. Here bioavailability means the affinity of the drugs to dissolve in their particular essential elements that will enable absorption into their deeper layers. The form of drugs may be aqueous solutions, aqueous suspensions, ointments, and inserts, etc. These all are the basic pharmacology of absorption of drugs through eye. Let us move on to the main topic, SECA. What do you mean by SECA? SECA is also known as Parisheka. Parisheka, it is to be noted that Charaka and Ashtanga Hridayakara has not mentioned the SECA procedure. Let us check out what is SECA. In the pictures you can see one Galandica is there and Yukta Kashaya Dravya, Tribala Kashaya you can see. Okay, let us check out what is SECA. Sekastu Sukshma Dharabhi Sarve Asmin Naine Hita Milititakshasya Martasya Pradeya Chadurangulat. This is a reference we can see from Sharangadhara Uttarasthana 13th chapter, 1st and 2nd sloka. What is this SECA? SECA is one among the Netra Kriyakalpa, in which the liquid medicine, that may be Kashaya or Krida, is poured as a Sukshma Dhara over the closed eye from a height of 4 angulas. It's approximately 8 centimeter in length. Okay, you have to be noticed, the SECA should be performed in closed eye only. It should be a thin dhara, thin stream from a height of 4 angulas. Usually, the patient is made to lie down in supine position in a quiet place devoid of wind and heat. So, then the liquid medicine is poured as a Sushmadhara over the closed eye from a height of 4 angulas. Okay, what is the difference between Shalana and SECA? In Shalana, the medicated liquid poured into the open eye from a height of 2 angulas. Usually, Shalana is performed as a Paschat Karma of Anjana Karma. So, what's the main difference of SECA and Shalana is, SECA is performed over the closed eyes, and the Shalana is performed in the open eye. Okay. Next sloka, Yata doshopayuktam tu nadi prabala mojasa roga mastodanam handi sekastu belavattaram. This is the reference we can see from Susrutam Uttaram. And here the SECA quickly cures the aggravated doshas which are stronger and dreadful in nature. Okay, the SECA is preferably done in daytime and also. In case of emergency and all, we can do SECA at any time. Okay, let us see what are the types of SECA. SECA is of 3 types. What are they? Snehana, Ropana, and Lekhana. Usually, Snehana type of SECA is used in Vadika disorders, Ropana in Pitta Rekta conditions, Lekhana in Kapha conditions. The duration of time for Snehana type of SECA is 600 Matra Kalas. For Ropana is 400 Matra Kalas, and Lekhana is 300 Matra Kalas. What do you mean by Matra? Let us check out what is Matra. Tatra Lekhu Akshara Ucharana Matro Akshinimesha. Tatra Lekhu Akshara Ucharana Matro Akshinimesha. It is a time of pronouncing a soft alphabet. So 1 Nimesha equals 192 microseconds, which is approximately equals 0.3 seconds. In Ashtanga Sangraha, we can see one reference. 3 Matra equals 1 Kashta, which is approximately equals to 4.66 seconds. So 1 Matra is approximately equals to 1.55 seconds. As per Ayurveda Pharmacopoeia of India, we can see 1 Matra is approximately equal to 1.5 seconds. So we can take 1.5 second Matra as second as 1 Matra. So you can calculate accordingly. Okay. In Snehana, usually the nature of medicine used for SECA is lukewarm oils such as Krida, Mamsarasa, Vasa, Majja, Medasa, Madhura Levana Aushadis. These all other drugs are commonly used for snake and seka. For Ropana seka, Tikta Rasa Dravya, honey, ghee, stanya, Jankala Mamsarasa has to be used. For Lekhana Karma, Jankala Mamsarasa, Loha Churna, Tamra Churna, Saindava, Kadu Tikta Kashaya Aushadis are commonly used. These all are the types of seka. Let us check out once again the procedure of seka. The patient is made to lie in supine position. The required medicines, usually kashayas and krida, etc., are taken in appropriate vessels. The patient is asked to close his eyes.
Hello, Dr. Ashwin. There is a short network issue. Dr. Ashwin is correcting now. Okay.
Hello.
Hello, doctor. Yeah, we
Okay.
can hear it now.
Okay.
You can share the slides.
Okay. Is it visible?
No.
It is not visible. Just a minute. Now?
Yeah, ready.
Okay. So, shall I continue from this slide?
Yeah.
Okay.
From the procedure itself.
Okay, yes. Okay. So, in seka procedures, patient is made to lie in supine position. So, the required medicine, such as kashaya, grida, etc., are taken in appropriate vessel. Patient is asked to close his eyes. Okay. Then, the appropriate medicine is poured in thin stream over the closed eyes separatively from a height of 4 angulas for required matra. So, the medicine which is collected in a kidney tray or appropriate vessel placed near the lateral canthus. Let us check out one video is there. Is this visible, Dr. Jasol?
Yeah, visible. Yeah, you can continue.
Okay. This is so the Kashaya Dara should be in a rounded manner. So make sure that it is covered all the areas around the eyes, including the orbital region. So let us see one more procedure is there, Kshalana. In Kshalana, the eyes should be open. Okay. So the main pharmacology of Sega, the disposal rate is more. Okay, the more medicines are washing out, just like a eye wash like procedure is the Sega. So due to this, the bioavailability is very less there. And the absorption also very less. There is no direct tissue contact there. Only skin contact is there. So there's a less absorption of biomedical contents. As it preferred on closed eyes, does not dilute the lysozyme. So there will be less absorptions there. The effect of Shirodhara can be achieved here. Thin continuous stream stimulate the nerve endings. And also the mechanical effects of washing exudates also happens here. This is the basic pharmacology of Sega. Let us check out a few points also. In effects, the Sega will stimulate the nerve endings, and also it increase the peripheral circulation, and there will be irrigation of obstructive exudates and reduced inflammatory lesion. So it is very much effective in curing the Ama Lakshana and all. Okay. Let us check out some Seka yogas, usually practiced in our hospital and exclusively in Kerala. In Sarva Abhishanda, we are using Narvi Katha for the Seka. In Vadika Abhishanda, Bilva, Eranda, Jadamamsi, Rihadi, Madhushikru are commonly used. In Pittacha Abhishanda, Shveda Lodra Madhuka combination, Tribala Siddha combination, Panja Tiktaga Guduchyadi Kashaya combination are commonly used. In Kabaja Abhishanda, Nagara, Tribhala, Nimba, Vasa, Lodra. This combination is very important. This is also known as Nagaradi Kashaya Dhara. Koshna Tribhala Kada is very common. Koshna Tribhala Kada can be used in Kabaja Abhishanda. Panja Tiktaga and Kudushadi Kashaya. It is to be noted that in Kabaja Abhishanda, the material used for the Sega should be of warm, lukewarm. Okay, in Shukshakhi Bhaga, you can see Kshira Saindava Seka. Here, the Koshna Paya and Saindava are mixed together, and it should be used for the Seka Dravyam. And also, Kridamanda can be poured over the closed eyes. And also, after Shastra Karma like Arma Cheda, Karanja Vida Siddha Kashaya Dhara is mentioned. In my common practice, I have observed that the Ushna Ubakada, photoophthalmitis conditions or heat exposure from welding and all, the tender coconut water used as Sega. I got wonderful results in photoophthalmitis and the welding exposure and all. And for retinal bleeding also, this combination is very much workful. Manjishta, Draksha, Amalaki, Lodra, Musta, Darvi, Ushira, Eshti, Chandana, Rekta Chandana. You can see that almost all the drugs are Pitta, Rektahara, and this is Shida, Virya drugs. Okay.
Hello. Yes, there is some network issues.
This yoga is very much effective. This Mandishta, Draksha, Amalaki, Lodra, Musta, Darvi, Ushira, Yashti, Chandana, Rekta Chandana yoga is very much effective in retinal bleeding and all. You can assess the guna and all. We can see that it is Pitta Rektahara in nature and is Shida Virya. Almost all the Reks are Shida Virya. In episcleritis condition and all, we can see that the Jadamansi, Chandana, Draksha, St, Kshirapaga is very much effective. And episcleritis. This is the one yoga. One another yoga is there. That is Siddha Karpuradiseka. This is very much effective in Arjuna. Arjuna is the condition you can see the subconjunctival hemorrhage. Here, the Siddha Karpuraseka has a very good action. Okay. In Akshishobha and all, the Pwada made of churna of Grida Prishta Shvedalodra. What is Grida Prishta Shvedalodra? Here, the Shvedalodra is fried in ghee and is made into a pottery. Then it is dipped in water and the kashaya is made. That kashaya is used for Akshishobha. It's very much effective. In Kerala, we are commonly practicing the Mridvika Adi Kashaya. It has a very wide range of action, especially in Pitta Rakta condition. We are commonly using Mridvika Adi Kashaya. It's a reference we got from the Yoga Amrita. It's a Malayalam Kerala yoga. Let us have a quick review of this slogan. Mridvika Madhuga Suradru Chandanabdehi Sevya Aksha Amalaga Haritaki Ikshilodrehi Nishkwatayes Taru Rachani Yude Nisheke Kartavyo Madhusakito Akshiroga Chande. There's a direct indication of Akshiroga in this Mridvika Adi Kashaya. These all are the common drugs. It's also available in North India and all. You can prepare this kashaya as a powder form and make some kashaya yogas. You can commonly practice in especially in Pitta Rakta condition in your clinic and all. Okay, it's a very important yoga. Okay, Mridvika Adi Kashaya. You can also refer that Yoga Amrita text also. Let us check out some Samyak Yoga Adi Yoga of Seka. Here, the yoga and ayoga are similar to those Tarpana and Pudapaga. For Astodhana, Seka, this yoga and ayoga are similar. So let us check out what is Samyak Yoga. Sukha Sopna Prabodhana, Sukha Sopna Avabodhattvam, Vaishadyam Varna Padavam, Nirvrittar Vyati Vidvamsa Kriya Lakhamevacha. This is a reference we got from the Susudam Putrasthanam 18 chapter 13 sloka. Let us check out what are they. Sukha Sopna Sopnava Bodhatvam. Sleeping and awakening become very much comfortable. There will be cleanliness and the clarity of colors observed by the patients. And there will be relief from diseases, lightness and easiness of movements of eyes. Kriya Laghavam Evacha. Let us check out what is Adi Yoga. Guruva Avila Madhisnikta Asru Kandupa Dehavat Neyam Dosha Samutklishtam Netram Adhyartha Tarpitam. This also from the Susurdha Sutrasthana 18th chapter. There will be feeling of heaviness, turbidity and tiredness, dirtiness and excess of anxiousness and flow of tears from eyes, itching, thickening and aggravation of doshas will be seen in the Adi Yoga of Seka and Astodhana. So these all are the Samyak Yoga, Adi Yoga of Seka. So you have to mug up these slogas. You can write in Seka, Astodhana and Tarpana Pudapaga also. Okay. So this sloga is very much important. So let us move to the second Kriya Kalpa. What is this Astodhana? These are nothing but the eye drops. This is the in this picture you can see the Gokarna along with one plotha or cotton wick is there, and the appropriate kashaya dravya is there for the Astodhana. Okay. Let us check out what is Astodana. Sarvesham Akshiroganam Ado Astodanam Hitam Duktoda Kandu Karshastru Daharaga Nivarhanam. So, first in all initial manifestation of ocular ailment, Astodana is beneficial. Okay, this reference I got from the Ashtanga Hridaya Sutrasthana 23rd chapter, first sloka. So, it should neither too concentrated or not diluted, neither too hot or no cold. Okay, Ushnam Vade Kabe Koshnam Tachidan Daktavitayoho. So, it should be applied warm in vitiation of Vada and Kapha and cold in Daktavita. The main indication of Astodana is this one. There will be Duktoda Kandu Karshasru Daha Raga Nivarhanam. There will be Duk, pain, Todam, pricking pain. Kandu means itching, Karsha means friction, Asru means lacrimation, Daha means burning sensation, Raga means redness. So, it is in your mind that the Astodana Dravya is properly filtered. It should be Sambramba Parisrutam. It should be properly filtered through double layered cloth. So, in total, the medicated drops are put into the eyes from a 2 inches height, 2 angular height. The physician has to open the eyes of the patient with his left hand and has to put the drops with his right hand. So, it is nothing but the eye drop itself. Let us see the main procedure of Astodana once. These references are from Ashtanga Hridaya Sutrasthana, 23rd chapter, 1 to 6 slokas. Nivadastasya vamena paninya unmilya lochanam Shukto pralambaya anyena tijuvartya kaninake desha dwadasha va bindun doyankulat avasetiye tadaha pramarjya muduna chelena. The person should lie on a place devoid of breeze. Nivadastasya vamena Paninya unmilya lojanam. His eye should be opened with the left hand of the clinician. Then, Deshadadasha Vabindun Doyangulat Avasejaye. 10 to 12 drops of medicines are to be instilled into the inner canthus of eyes from a height of 2 angulars. The height through a scrolled cloth hanging from the Shukti. In the beginning picture, I have shown one Shukti. This one is the Shukti. That one cotton wig you can see here. This is a Shukti, cotton wig. This Gokarna is said to be Shuktika. Okay, it can be of an eye drop bottle and all. We can in the absence of Gokarna, we can use some small vessel and all. Okay. This is the meaning of Shuktika. Shuktika means as medical dispenser. That's the meaning of Shuktika. Okay. Then the eye should be cleaned with a soft cloth. What is that? Tadaha pramarjya mriduna chayelena. Let us check out the types of Astodana. What are they? Snehana, Ropana, and Lekhana type of Astodana we can see. In Snehana Astodana, usually indicated in Vadika disorders, which is of 10 drops. The nature of medicine in Snehana type of Astodana are lukewarm oils. Madhura Amla Aushadis also can be used as Snehana Astodana. In Ropana Astodana is mainly indicated in Pitta Rekta disorders, which is of 12 drops, and mainly Tikta Kashaya Madhura and Shida drugs are commonly used as Ropana Astodana. In Lekhana, usually indicated in Kapaja disorders, 7 to 8 drops are commonly used. Lukewarm water, Kadu Tikta Aushadis are commonly used as Lekhana Astodana. What the time for the application of Astodana? In Vada Prakopa, Aparakna is the choice of time for the application of Astodhana. Pitta Gopa, Madhyakna, and Kapha Pragopa, there will be Purvakna is the time for choice. In vitiation of Kapha and Vada, the mild fermentation with another cloth soaked with warm water is very essential. If we are pouring Adi Shida Kashaya, what will happen? It produces pricking type of pain and loss of movements of eyes are the demerits. Excessive dosage may produce turbidity of eyes. There will be conjunctival congestion, friction, and difficulty in opening of lids are commonly seen. In inadequate therapy leads to exacerbation of disorders. The unfiltered drug also causes irritation to the eyes. So it should be properly filtered to double layered cloth. Okay, let us see what is the action of Astodhana. Getwa Sandhi Chirograna Mukasrotamti Preshacham Murtagan Nayane Nesta Avavartayet Malan. The medical principles which entering the channels of joints of eyes, head, nose, and mouth. Then the medicine will expel the malas, that is the vitiated dosha seated at the higher level. The Samyak Yoga and Adi Yoga are same as the Seka, as I have explained earlier. Let us check out the main pharmacology of Astodhana. As I said earlier, 80% of the drop instantaneously drains through the lacrimal duct. The absorption will be, regarding absorption, we can see most of the decoctions are aqueous extracts of different plant materials containing active principles in assimilable form facilitating absorption. The bioavailability also is very less here. Because the drug administered in aqueous form, which will with short tissue contact time, almost 80% of the drops are instantaneously drains to the lacrimal duct. So the bioavailability of is very less here. The absorption rate is maximum due to increased corneal permeability of inflammations. Most of the Astrodhanas are contraindicated in night because the therapeutic concentration cannot be achieved during the night time. This is the basic pharmacology of Astrodhana. These are the common Astrodhana yogas commonly practicing in our hospital. Astrodhana, Tribala Kashaya. All kinds of Abhishanda we can use the Tribala Kashaya Astrodhana. Is Tanya Astrodhana in good for Vada Pitta Rakta Janeta yogas. Almost all the Nayana Vikadas we can use the Tanya as Astrodhana Dravya. It having Sheda Nivaraka properties. So, Stanya is the best choice for that Nayana Abhikada. Okay. Astrodhana with Shigru Patra Sarasa is used in Daktaja Abhishanda. This is as per text. In my common practice, I won't use Shigru Patra as such. I have mixed Shigru Patra Sarasa with the honey. It will dilute its Teshnatva. During my PG studies, I have one experience. One of my colleague put some Shigru Patra Swarasa itself to a Abhishanda patient. Suddenly, he got some irritation in eyes. There's a crescent shape subconjunctival hemorrhage seen on his upper eyelid, upper bulbar conjunctiva. So, it is to be noted that Shigru Patra Sarasa as such is not preferable. Okay, Astrodhana with the Amalaki Phala Sarasa is used for Pitta Chabhishanda. It's common, very common thing. And the Astrodhana using milk and ghee are used in Rakta Chabhishanda. It is very much commonly used thing. Astrodhana with medicated milk prepared from Kandakari Moola is used in Vada Chabhishanda. And Sharkara Mastu Shaudra combination in Arjuna. Arjuna Sharkara Mastu Shaudra is Astrodhana. This is a direct indication of Astrodhana in Arjuna. Sharkara Mastu Shaudra combination. It's very much effective. This is all about the Astrodhana. Let us check out what is Pindi. Pindi is also known as Kabalika. Pindi Kabalika Prokta, Betire Patta Vastrake. You can see in this picture, this lady has wear one Google like eye bandage. Okay, I will explain this to you. Let us move on to the slogas. Pindi Kabalika Prokta Betire Patta Vastrake, Netra Abhishanda Yogyasya Neshu Abhinibhatyate. This is your sloga is taken from Sharangadhara Uttarasthana 13th chapter 21st sloga. This is one among the modification of Bidalaka. Instead of directly applying the paste to eyelids, they are packed in a thick cotton and are kept tightly over the eyelids. This should be useful in early stages of all the eye diseases in general, and especially the Abhishanda in particular. It's very effective in reducing the inflammatory features proceed due to the trauma, wounds, etc. Okay, it should be, its pramana should be in kola matra. Pindi can be kept for 24 hours or overnight. If patient experience any irritation and all, you have to remove the pindi as soon as possible. During my PG time, I have experienced one person complaints of itching over the eyelids after putting the pindi. We are used that Guduji Kumari pindi at that time. Because the close contact with this pindi material, the patient experienced severe itching. We removed that pindi and do one sega at that time. Then after the sega, patient experienced well. So it is very important to keep pindi very carefully. Otherwise, patient experience much irritation and all. Okay, let us check out how to prepare a pindi. The first picture I have taken some Triphala churna. In second picture, I have taken honey. The third picture, you can see one ghost piece. Okay. Then the honey is added to the churna and is made into a bolus form. Then the bolus form is covered with a small pieces of ghost piece. Then it should be applied over the closed eyelids, and the China Banda also is made. China Banda are you're familiar with the China Banda in Challi and all, it is commonly used. Okay, this procedure can be also be done with the this also by this also. We can already prepared a packed medicine packed thin cotton. It's just like a eye bandage you can prepare, and it should be tightened very well. Okay, by this method also we can do the pindi easily. But the most appropriate method for pindi is this one, China Banda and all. Okay. Let us check out the common pindi yogas as per my experience. Okay, Tribala, honey, Murivenna, Durvagrita. This is very much effective in exophthalmos, glaucoma, and netra abhikada conditions. Murivenna is a special kind of thaila which are usually common in wound and all. Durvagrita is commonly used one. And the Erenda Patramula Tok Pindi is very much effective in Vadiga Abhishanda. Shigru Patra Pindi is very much effective in Kabaja Abhishanda. Dhatri Pindi is nothing but the Amalaki Pindi in Pitaja condition. In the Pitaja condition, Mahanimba Bhala Pindi also very much effective. Nimba Patra Pindi is effective in Kabacha and Paitiga conditions. Koshna Shigru Patra Pindi as Tapa Sveda for Ama and Pachimana Shobha. Or Pidaga and all that sky and all we are using Koshna Chigurupatra Pindi. Goduma Shashtika Shali. That means the Goduma or Shashtika is cooked in Shira, which usually used in Shiroroga. In Vadika, Shiroroga and all, there will be referred pain in the eye. We are using This Goduma Shashashali Pindi in eye pain associated with the Shiroroga. These are all common yogas. And one more Pindi yoga is Bandhana with the cow dung basma. Usually in blisters of eye we are commonly using. There will be a Paitika associated condition we are using Bandhana with the cow dung basma. Okay, these are all the common Pindi yogas commonly practiced in Kerala. Okay, this is all about Pindi. Let us move on to Bidalaga. This is the Bidalaga yoga. What is Bidalaga? Bidalako Beherlepo, Netra Pakshma Vivarjita. These are the references we got from Sharangadara Uttarasthana, 13th chapter, 30th sloka. Here the application of medicated paste into the outer surface of the eyelids. Pakshma Pariharena Akshi Koshalepanam. This is the reference from Ashtanga Sangaraha, Sutrasthana, 22nd chapter, 3rd sloka. Pakshma Pariharena Akshi Koshalepanam. Acharya Ashtanga Sangrahara has mentioned Akshi Koshalepana as Bidalaga. Here, this space should be restricted to the lids, not extending to the eyelashes. Okay, let us check out what all are the indications of Bidalaga. Utpanna Matre Tarune, Netraloke Bidalakam, Kari, Daha Upadeha, Astru, Shobharaga Nivaranam. Utpanna Matre Tarune, Netra Roke Bidalakam, Karyo, Daha Upadeha, Astru, Shobharaga Nivaranam. This is a reference we got from the Charakam Chikilsa, 26th chapter, 231 sloka. There will be Daha, burning, Upadeha, there will be discharges, Astru, Shobha, Ragata, there will be redness or congestion, Toda, Kandu, Karsha, Karsha means a foreign body sensation. Such a wide range of initial symptoms of eye diseases can be controlled by Bidalaga yoga. What is the matra of Bidalaga? Tasya matra parikneya mukhalepa vidhanavat. This is the sloka taken from Sharangadara Samhita, Uttarasthana, 13th sloka, 13th chapter, 20th sloka. There will be thickness of paste in Bidalaga is similar to that of Mukhalepa. Dr. Sridevi has already mentioned in the first previous classes regarding Mukhalepa while taking the Patyas. Mukhalepana Shilinam Dridam Bhavati Darshanam. There will be direct indication of Darshana Samarthya in Mukhalepa. So, let us have look into the types of Bidalaga. There will be Doshakna, Vishakna, Varnya type of Bidalagas are available. Doshakna, the thickness of the paste should be 4 angula, and Vishakna 2 angula, Varnya type half angulas of drugs are commonly applied over the closed eyelids. After the application of medicine, the excessive speaking, jokes, anger, grief, pandering under sun, day sleep are strictly contraindicated. These are the references I got from the Ashtanga Sangraha, Sutrasthana, 21st chapter, 8th sloka. Let us have a look into the procedure of Bidalaga. In this picture, you can see the Bidalaga. For easy application of paste, it should be starting from the lower eyelid. Then you have to spread the medicine to the upper eyelid. One thing, you have to be After the paste dries up, it should be moist. Cotton piece is used for the removal of the Vidalaga Dravya. Later, the lid should be anointed with oil. After Mukhalepa also we are applying oil over the Mukha. Likewise, soon after the Vidalaka, the skin over the eyelid should be felt Rushatvam. So in order to regulate the Rushada of the skin, we can apply some Snigdha Dravyas over the eyelids. Let us have a quick look onto the mode of action of Pindi and Vidalaka. It reveals the inflammatory conditions by vasodilation. Locally, the Vidalaka increases the temperature, local temperature, and the faster expression of toxins because the tissue contact time is more in case of Pindi and Vidalaka. So the faster expression of toxin will be there. The reduction in IOP by mainly it is indicated in Pindi and all. There will be mechanical effect of pressure and vasodilations, drainage effects occurs will be helped by the Pindi procedure. There will be more absorption to the lids. There will be tissue contact time is more. So the transcutaneous absorption and pressure effects is more in case of Pindi and Vidalaka. There will be better compliance also. So this is all about the mode of action of Pindi and Vidalaka. This is one among the common Vidalaka yoga widely practiced in Kerala. This is Mukkadi Vidalaka. In my personal experience, I have used it for the almost all the conditions of inflammatory conditions. It will subside within 5 days, not 5 days. Within 2 to 3 days, there will be wonderful results I got. Let us check out what is the yoga of Mukkadi Vidalaka. This is a Malayalam yoga. Mukka Chengal Kulirina Karthoti Devadramam. This is a yoga. I have some listed the ingredients in that. Tribala, Shuddha Gairiga, Chandana and Ekta Chandana, Nisha, Lodra, Gopi. Gopi means the Shariba, Vadasringa, Durva, Ushira, Nimba Patra are the ingredients of Vidalaka. You have to be powder this except that Vada Sringa and all you have Vada and Durva except that you have to powder all the ingredients together, and at that time you can mix the Vada Sringa and Durva Sarasa and Nimba Patra to that. Then it should be grinded well and should be made into a small bolus like structure, just like small amalaki phala. And then the guliga has to be made by drying it in shade, and the paste of the guliga is prepared with the milk at the time of application and should be applied over the closed eyelids, excluding the eyelashes and eyebrows. Okay, this is a very much common yoga commonly practiced in Kerala. These are some Vidalaka yogas in our common practice. Saindava Nagara Marshika is very much effective in Vadika Abhishanda. Jadamamsi Patmaka Chandana HT is commonly used in Pitta Rektacha Abhishanda. Manoha Shuddha Manashila, Pippali honey is used for the Kabaja Abhishanda. The combination of above said drugs are upon the uti of the Vaidya used in Sannipavya type of Abhishanda. As I said earlier, Mukkadi Guliga, we can apply for all the Shopa, Rucha, Daha condition and all. Yeranda Pallava, it should be cooked in Shira for acute glaucoma. Bala Haridaki, plus honey or Kanjika, we can use in Anjana Pedaka, Legana and all. And also the Maricha macerated with the Bringaraja Sorasa is very much effective in Arma and all. Okay. Let us move on to the next topic, Anjana. What is the Nirukti of Anjana? Anakti Anena iti Anjana, that which spread in the eye. That is the Nirukti of Anjana. Anakti Anena iti Anjana. Okay, let us check out the procedure of Anjana. Vekta Rupeshu Dosheshu. Shuddhakayasya kevala netra eva sthite doshe Prattamanjanamajare. This is the reference we have got from the Susura Uttaram 18 chapter 51 to 52 sloka. The procedure of application of medicine to the internal surface of margin from Kaninaka Sandhi to Apana Sandhi by using Anjana Shalaka or fingertip is called Anjana Karma. According to Susruta, the Anjana is indicated when the doshas are fully manifested and are localized in the eye. The Anjana should be applied when the diseases should be clearly manifested and indicating dosha dushti and is nida adhisthana, and the body should be free from ama lakshanas by our panchakarma procedures like vamana, virechana, adi, nasya karmas, and the features of dosha dushti is limited to eyes. At that condition, we can start the Anjana. Adha Anjanam Shuddha Dhanayoho. The Anjana should be applied in Shuddha Dhanu. Netra Matra Sridemala Manda Kashasru Rage Achni Prayojyam Khana Doshike Arte Pitta Kapasiti Madatena Visheshada. Anjana should be applied in all timings in Vasanta Ridu, and it should be applied in the morning time in Grishma Ridu. In Varsha Ridu, there is the absence of abrada, na atyushna avastha. We don't use the Anjana Kriyakalpa during the Varsha Ridu. In Sharat, every time we can, evening we can use the Anjana Karma. Shishira and Hemanta Ridu, Madhyakna is the time for the Anjana Karma. According to Vagpada, there should be a sign of Pakata of dosha such as Alpa Shobha. There will be slight edema and Adikandu Paisilia. There will be slightness of in the eyes. The exudates of eyes should be thick, reduction in lacrimation, friction, and redness of eyes. These are all the conditions in which we can use the we can start the Anjana Karmas. The best thing you have to be in your mind that it should be in the Shuddha. Malas are located in the doshas are located in the eye. The raga and other features are subsided by the Seka, Ashodana, Pindi, Bidala like procedures. You can start the Anjana Kriyakalpa properly. Otherwise, it will create some problems in the eyes. Let us check out what all are the types of Anjana. There are three types of Anjana mainly: Ropanam, Lekhanam, and Prasadana type of Anjana. Ropana Anjana, for example, Dasanjana, Madhu, we can use as Ropana Anjana. Tiktaga Dravya, Snehana, Tiktaga plus Sneha Dravyas used as Ropana Anjana, used in Ropana Anjana. In Legan Anjana, for example, Mudga Anjanam, Siddha Manachiladi, Jadi, Mughladi Varti, other Kashaya, Amla Levana, Kadu drugs are used for Anjana Karma. Jadi, Mughla Sindhutta, Devadaru Mahoshadam. That is the reference of Jadi Mughladi Varti as the Lekhana Karma. Prasadana Anjana include Vasanjanam, Kridamakshi Anjanam. There is one other reference of Jadi Mughladi seen in Ashtanga Hridaya. Vartyor Jadi Mughla, Laksha Gairiga Chandanam, Prasadayadi Pittasram, Khandija, Shada Shukragam. Okay. There is another one reference from Swarna Basma plus Krida used as Prasadana Anjana, Madhura Aushadha Dravyas plus Sneha used as Prasadana Anjana. Okay, another one classification is there: Gudika, Rasakriya, Churna. This is the mode of administration. According to the mode of administration, for Mahabala Rogas, the Gudika is used, and for Madhyama Bala Rogas, Rasakriya is the choice of administration, and Churna in Hina Bala Rogas. Let us check out the examples of Gudika Anjanas. Chandana Varti, Jadi Mughladi Varti, Pashupada Varti are the examples of Gudika Anjana. In Rasakriya Anjana, we are commonly used Ilamir Koyamba, Kajayapanam, Mudga Anjanam, Kanasaindavadi Anjanam, etc. are coming under Rasakriya Anjana. Ilamir Koyambu are widely used in Kerala. It's commonly in Pitta Rakta conditions. All we are using the Ilamir Koyambu. Churna Anjana include Marija Anjanam, Bhaskara Churnam, Maricha, Mamsyadi, Churna Anjana, we are commonly using as Churna Anjana. The dosage of Gudiga Rasakriya Churna in Lekhana Ropana Prasadana are 1 Harenu for Gudiga and Rasakriya, 2 Shalaga for Churna Anjana in Lekhana Anjana. And Ropana, the dosage of Gudiga and Rasakriya is 2 Karenu and 3 Shalaga for Churna. And Prasadana, 1.5 Harenu for Gudiga Rasakriya, 4 Shalaga for Churna Anjana. Let us move on to Anjana Shalaga. What is Anjana Shalaga? Anjana Shalaga should be 10 angula length. The Shankula Tanurmadhye Shalaga Mukulanana, and the 2 ends of the Shalaga should be blend and it's less like a jasmine flower. Mukulanana. Which, for easy handling, it should not be rough, thin, hard, and breakable. The shalaga should be prepared with the metals like Swarna, Raupi, and Tamra, etc. In Ashtanga Hridaya, we can clearly see Robane, Lekhane Tamri, Robane, Kala Lokaja, Anguli, Suvarnotha, Ropyacha, Prasadane. In Lekhana Karma, Tamra Shalaga is used. Lekhana Anjana, Tamra Shalaga is used. Ropana Anjana, Kala Loha, and Anguli also used for the Ropana Anjana. And Prasadana Anjana, Suvarna Shalaga or Raju Shalaga is preferable. This all are about Anjana Shalaga. Let us check the time for Anjana. The Anjana should be always applied in morning and evening when the surroundings are not cloudy and sun is shining. Okay, so the Tikshna Anjana also not applied during the daytime. Okay, this must be in your mind that it should be applied in the night time. Let us check out what all are the contraindications of Anjana. I have already given the notes to you peoples. Na Anjaye, Theta Vamita, Vidikta, Ashita Vekita, Krutha, Jurita, Tandwakshi, Shirorup Shoga Jagare, Adashte Arke, Shiragasnade, Pidayo, Duma Madhyoho, Ajirne, Agni, Arka Samdate, Vivasukte, Pivaside. This is the sloka taken from Ashtanga Hridaya Sutra Sthana 23rd chapter, 23rd sloka. Let us check out what all are the contraindications of Anjana Karma. Bhita, one who having fear or phobic. Vamita Virikta, one who administered a emesis or purgation procedure. Ashida, one who just had food. Vegita, under the natural urges of anger. Or Jorita Tandakshi, there will be fever is there, fatigue is Chiroruk, Shoga Jagaram, there will be headache, grief, who had slept not well in the previous night. Adashte, when the sun is not visible. Chiragasnadam, Pidayor Dhuma Madhyoho, after the head bath, inhalation of smoke, alcohol. Ajirna, indigestion conditions, Arka Agni Sandapta, exposure to fire and sun, Vivasapna Vimasida, after day sleep, when the subject is thirsty. These are the conditions in which we are not practicing Anjana. Okay, let us moving on to the Pradhana Karma of Anjana. Okay, as Pradhana Karma, the physician should open the patient's eye with his left hand, holding the rod in his right hand. Then apply the Anjana either at Kaninaga Sandhi or Apanga Sandhi. Then it can be smeared to inner side of the eyelid using the finger itself. Vamena Akshivinir Puchya Hastena Susamahitam Shalakaya Dakshinena Shipet Kanina Manjanam Apangam Va Yada Yogyam Kurya Chapi Yadagatam Patmot Lebiva Yet Anguleva Prayoktaye. This is a reference we got it from Susruta Uttara 18th chapter 64th and 64th sloka. So after the proper administration of Anjana over the in the lower eyelid, we have to do the Paschat Karma. What all are the Paschat Karma? Nacha Nishavanda Dosha Akshmi Dhavanam Samprayojayet Doshaka Pradinivartaha Sanhandya Dishtam Belam Dada. After the cessation of irritation, due to the administered anjana. When the eyes are calm, the eye should be washed with appropriate kashaya or lukewarm water. So these are the pastat karma of anjana. Then the physician should lift and hold the upper lid of the left eye with right hand and thumb. Then clean the inner part of the eye and the lower lid with a cloth. Vice versa also we can do the procedure. If the eyes are fatigued by strong anjana, we can use the pratyanjana. There is a reference of pratyanjana in Sushruta. The pratyanjana is nothing but the Saviri anjana, which is usually in the form of churna. Churna anjanas are the pratyanjanas are commonly used. We can use these churna anjana very well as a pratyanjana. So this is all about the anjana karma. Let us see the pharmacology of anjana karma. As you all know that there is a minimum disposal rate in case of anjana karma. We are applying a particular amount of anjana dravya in the lower eyelid, so there will be minimum disposal rate. Tissue contact time is more in case of anjana karma, so the bioavailability also more in this case of anjana. There will be maximum absorption. Mainly the subconjunctival injection absorption and the scleral absorption is more in case of anjana karma. Most of the drug we are using in anjana karma include arsenic and mercurial compounds. Obviously, it's a larger molecular size larger molecular. It's having the larger molecular size. It can enter the scleral circulation by the topical application of application of anjana. So its effects will reach the posterior segment disorders. Its medicinal properties will reach, it will cross the retinal blood vitreous barriers, and this will reach the posterior segment. And mainly the retinal pathologies we can do the anjana karma regularly. Usually the medicine which are administered to the systemic route or local route cannot cross the blood aqueous barrier, vitreous barrier. Instead of this, the anjana, by practicing the anjana karma, it will reach the posterior segment also. This is about the pharmacology of anjana karma. Let us see the anjana yogas commonly practiced. Chandana, Adivarti, Raktakata Chirikara, Ilanir Koyambu, Pittarena, Arama Timira conditions we can use. Mutka anjana means Shuddha Shuklam. Krida Maksham anjana means Chidotpadam, Jadi Mugladivartin, Shada Shuklam, Kana Saidavadin, Sannipadiyatimiram, and Nagulantiam. Pashupadavarti, we can use in Sarva Abhishandam. Pathyadivartin, Sarvatimiram. These are the common anjana yogas. You guys are always familiar with these anjana yogas. These all are the common yogas we are commonly practiced in the hospital. Madhuga, Haridra, Haridaki, Devadari, founded with goat milk is usually we are playing Madhiga Abhishanda. Nilotpala, Shiguru Bicha, Naga Kesara is used in Adinitra. Churna Rasakriya of Saindava, Adraga, Kasisa, Loka, and Tamra is used for Puyalasa conditions. Equal parts of Haridaki, Tutta, Ishki Madhu, and 16 parts of Maricha mixed with cold water is very much effective in Sarva Netra Yoga. Okay. And one thing you have to notice is Vilvadi Guliga. It is a very much important in Sapnya Prabodhana in Mada, Morcha, Sannyasa. In one patient, I have an experience. Patient with Mada. We applied the Vilvadi Kulika as a Sapna Prabodhana Dravya. It's very much effective on that conditions. And also Vilvadi Kulika has a special effective in Visha condition and all. It is granted with Tulasi Sarasa, mainly used for the Visha Damsha, Hida Damsha around dice and all. It's used as Bidalaka form commonly. Let us move on to Tarpana Kriya Kalpa. What is Tarpana? Triptin Dadadi Tarpanam, Tarpedi Idi Tarpanam, to nourish or irrigate. That's the meaning of Tarpana. Triptikaram, Karmam, Tarpanam. Okay. It's one among the 7 Kriya Kalpas. It's indicated in mainly Vada Pitta Vigaras of curative and preventive effects. Okay. It's all administered only after the severity of symptoms such as redness, lacrimation, pain, foreign body sensation, exudate discharges are reduced. It's also used in the Shuddha Tanu when Vamana Virechana like procedures by which the doshas are eliminated. Then only you have to do the Tarpana. That's the direct indication we can see in the Swaga itself. The mainly we can see the indication of tarpanas adure shantaragastru shula sambramba dushide nivade tarpanam yogyam chuddhayor urthakayoho. Just a direct reference we can see in Ashtanga Hridaya Sutrasthana 24th chapter 3rd sloka. The tarpana is administered only after the severity of symptoms such as redness, lacrimation, pain, foreign body sensation, exudates, etc. are reduced. Okay, as I have already mentioned, these are the conditions in which we can do the Tarpana procedure. Let us move on to the indications of Tarpana. What are the indications of Tarpana? In Nayane Tamiri, there's one sloga in Ashtanga Hridaya, Sutrasthana, Tarpana Padabhaga Vidhi, Adhyaya, first sloga, Nayane Tamiri Sabde, Shushke, Rukshe, Abhidavide, Pada Pittadure Jishme, Jirna Pakshma Vilekshane, Krichron Mila Siraharsha, Sirot Pada Tamorjine, Sendamanda Nido Vada, Vada Pariye Shukrahe, Adure Shantarahasru, Shula Sambramba Dushire. Tamyata. What is Tamyata? There will be fatigue, Stabdata, inactive form of ice, Shushkada, Roshada, dry or roughness in the ice, Abhikada, if there is an injury to the ice, Jikma, strabismus conditions, Jirna Pakshma, falling of eyelashes conditions, Avilekshana. These are the refractory errors. Krichon Milna, inability to open the lids, Sirodpada, conjunctival congestions, Siraharsha like Panas, Tamra, blackouts, Arjuna, subconjunctival hemorrhages, Senda, conjunctivitis, Samanda, glaucoma, Anyatavada, trigeminal neuralgia, Shukra, corneal opacity. These are the conditions we are commonly indicating the Tarpana. As I said earlier, the process of purification of body is essential for the administration of Tarpana. So before that, we can use a sponge bath of closed eyelids with lukewarm water for the Purva Karma, as a Purva Karma of Tarpana. In Pradhana Karma, I have read the sloka. Kale sadharane pradam sayam chautena chayana eva mashamayi pali netra koshadhi samam dvayangulascha dadam krutva yadasam siddhamate tatpranimilide netre taptambu pravilabidam naktanti vadatimira vichrabodaadike vasam apashmagrat adhonesham shanahehi tasya. Main time of administration of Tarpana is in morning and evening preferably. The place of administration, the room, should be devoid of dust, smoke and bright light. Should be done only after the previously taken food is properly digested. Okay, this thing have to be in your mind while doing the Tarpana procedure. Let us take out what are the Pradhana Karmas include. The patient should be lie on his back. A pali. Pali means a small ball. Should be made with a dough of Eva. Eva means barley. Masha is the diagram. It should be in a ratio of 1:3 around the orbit to a height of 2 angulas. It's merely 3 centimeters and all. After creating this fence like wall, like Eva Mashimai Pali around the eyes, ask the patient to close his eyes. Then the liquefied medicated ghee, usually we are preferring the ghee for the Tarpana procedure, should be poured into the orbit. Prior to that, the ghee should be filtered well, otherwise there will be falling sensation experienced by the patients. The ghee should be poured into the orbit till the level of tip of the eyelashes. For Naktandhya, night blindness, Vadiga Timira, Krichra, the difficulty in opening eyelids, we are commonly using Vasa, muscle fat as Snehana Dravya. Then instruct the patient to open his eyes slowly and start counting the time. This is the procedure of Tarpana. You can see Evamashamayi Pali is created around the eyes. Then the medicated drugs are poured into both eyes at the level of eyelashes. Then ask the patient to blink his or her eyes. Okay. let us check out the time in Matra of retaining medicine according to the part affected. For Vatma, 100 Matra Kalas are said by Vagpada Acharya and Susuda Acharya. It's almost about 50 seconds approximately. And Sandhi, it's 300 for Vagpada and 500 for Susarda. It's about 2 minutes 30 seconds in Sandhi as for Vagpada. Siddha, 500 Matra Kalas is about 4 minutes 10 seconds. And 600 for Susarda. In Siddha Pradesha, 700 Matras is about 5 minutes 50 seconds approximately. And the Drishti Pradesha, we have 800 Matra Kalas should retain the medicine. It's about 6 minutes 40 seconds. For Sarvakshi and all, 1000 Matra, Adimanta Roga, Vadika Netra Yoga, we should get the medicine for 1000 Matras. For Sosta and all, Kabaja Netra and all, we are putting it for 500 Matras. It's about 4 minutes 10 seconds. In effect, maximum time for the Tarpana retention is 8 minutes 20 seconds. Nearly maximum 10 minutes are commonly practiced. This I have already discussed. There's a duration of Tarpana according to J. Jada. For Alpa dosha, you have to perform Tarpana for 1 day. For Madhyama dosha, you have to perform it for 3 days. For Adi dosha, 5 days is recommended. As Paschat Karma, Acharya has mentioned, Kritva apange tato dwaram sneham patretu galayet pibecha domam na akshet yomam rupam cha basuram. The sneha dravya should be removed through a hole made at the bottom of the dove wall near the outer corners of eye. And the sneha should be collected in a vessel. Then the patient should be inhale the herbal smoke. Usually we are giving the Haridravarti as the Dhuvana Dravya. Instruct the patient to not look at the sky and bright object. After Snehana Karma, as a Paschat Karma, we are giving the Kabala Dravya also for the patient. Okay, in order to prevent the dosha of the Dhuma Dravya. And the Tarpana should be done daily in Vadiga condition. In Pitta condition and all, we can do the Tarpana in alternative days. In Sosta and Kabha Visheshan, we can do the Tarpana at an interval of 2 days. Okay. To prevent the complication, I have added some points to you people. In Vata Kapha, the Tarpana Dravya should be slightly warm. Whereas in Jakta and Pitta, it should be little cold. Okay. An increase in Tikshna Ushna Guna may lead to adverse effects such as inflammation, burning sensation, and all. In some pharmacy, we are getting the Tikshna propertied Jivandyadikrada and all. At that condition, I have experienced some difficulty while doing the Tarpana by the patient side. And a decreasing quantity and temperature of the medicine may produce excessive lacrimation, difficulty movements, pain, and foreign body sensation. So the quantity should be maintained well. And increasing the quantity and time of retaining of medicine may lead to complications like redness, shrinking, spasm of ocular muscles. Okay. In one patient came to us complaints of difficulty in vision and all. In that patient, one Ayurvedic hospital, they did frequent Tarpana for more than 20 days. It will affect her vision. Then we referred her to one modern hospital. they said that there will be total loss of vision is there. Then she went to an Ayurvedic medical college nearly in Tripunthara. That madam did some Anjana Prayoga, Sega Prayoga and all. Again, the condition is improving as per her words. And a decrease in quantity time and the time of returning of medicine may leads to provocation of doshas. Okay. If there are any complications, if any, are managed by suited application of Nasya, Dhumapana, Anjana, Sega, etc. Then, as I mentioned earlier, there will be some Samyak Lakshana, Adiyoga, and Ayoga. As I have mentioned earlier, we have discussed while discussing the Sega and all. Prakasha Kshamada, Swastham Vishadam Lepalochanam Tripte, Vivaririya Tripte, Adripte Srashmika Ruja. And Samyak Yoga and Adiyoga also we discussed earlier. These are the main sites of action of Tarpana, optic nerve, conjunctival cells. These are the common things you are familiar with this. And the Jivaniya Krida mainly used for Timira and Shushkakshi Paga. And the Krida is extracted from the Chira processed with the Madhura Oshada is normally used for Pitaja Timira. Krida processed with the Kashaya of Vanaspati Haridra Oshira is Kabaja Timira. Krida extracted from Chira is in Dhuma Darshi and all we are commonly using. Let us moving on to the procedure of Pudapaga. In Pudapaga, it's just as our body becomes fatigued after the Snehapana, like our eyes are also become fatigued after Tarpana. Sneha Pita Tanadiva, Nanda Siddhyashi, Dishtarhi Sidadi, Tarpana Anandaram Tasma, Drigbala Adhana Karanam, Pudapagam Prayunchita. The Pudapaga is a kind of retention procedure which imparts the strength to the eyes. There are three kinds of Pudapaga we can see in classics. What are they? Snehana, Lekhana, Prasadana. And this matra is about 200 matra for Snehana, 100 matra for Lekhana, 300 matra for Prasadana type of Pudapaga. Let us check out each and every Pudapaga. Pushaya Prasaga Anupa, Medo Majjavasamishi, Snehanam Paisaga Pishte, Jivanishta Kalpe. The Medas, Majja, Vasa, Amisha of Bhushaya. Bhushaya means animals lives in the burrows. The Saha, that which bite their food by extending the neck and all that is known as Prasaga. These prepared with the suitable milk and all. These drugs are taken and this meat and all are taken as and is grinded well with the milk and other unit drugs are mixed to that and is macerated well. Then the extract which coming from that particular material, that bolus should be taken as Pudapaga rasa. In case of Snehana Dravya, in Lekhana, it should be done with the Ekritta meat of animals, birds, of and the Mukta, Ayas, Tamra, Saindava, Srodo, Anjana also used in Lekhana type of Pudapaga. In Prasadana, Bhagavakshi Ekat Macha, Vasanda Kride Amishe, Masa Madhure Kride, Tanyak Shire Pushte Prasadana. This reference from the Ashtanga Hridaya Sutrasthana 24th chapter. It should be done with the Ekrita, Majja, Vasa, Hridaya and meat of animals, of birds and animals, and also drugs of seed taste also mixed in Prasadana type of Pudapaga. Let us see the preparation of Pudapaga rasa. The first picture you can see that the appropriate medicines are chosen, whether it is a Snehana Pudapaga, it is Lekhana or Prasadana. Then according to the condition of patient, we can choose the medicine. Then the paste of meat and other drugs are separately made into bolus. And the bolus should be of the size of a Vilva Bhala and it's wrapped with the suitable leaves. There is one reference from Ashtanga Hridaya Sutrasthana. For Snehana Pudapaga, the bolus should be wrapped with Urubuga, Eranda Patra. For Lekhana Pudapaga, the bolus should be wrapped with Vada, ficus leaves. And prasadana, it should be wrapped with the amboja, Nelumbo nucifera leaves, and should be plastered with mud. Thereafter, the bolus should be placed on the fire, dhavadhanvana, or the dried cow dung, gomaya chakriga, until they become red in appearance. So, after cool off, the bolus of flakes are taken out from dhavadhanvana, and the juice is extracted from, should be administered to the eyes. The same procedure as tarpana. Okay, in this picture you can clearly see that the procedure of preparing the Pudapaga rasa. Then the patient should adhere to healthy regimen for double the number of days of therapy. And during the night time, it is advised to take a flower bandage using the Malati and Mallika Pushpa regularly. These all are about the Pudapaga. Let us check out the pharmacology of Tarpana and Pudapaga. Obviously, there will be more absorption. Okay, the drugs are lipid soluble, and so there is a penetration is very much high, irrespective of the molecular size. As I said, in case of Anjana Karma also, there will be absorption more. The same like that, Tarpana Karma and Pudapaga, the absorption will be more. The tissue contact time and bioavailability is more in case of Tarpana and Pudapaga. So most of the ghee preparations used for Tarpana are in the form of suspension containing different particles of drug which do not leave the eyes quickly as solutions. These medicines also penetrate to the sclera and reaching the posterior segment easily. So without any doubts, we can say Tarpana is the best in posterior segment disorders. Okay. These are some Pudapaga yogas from classics. The Krida extracted from Kshira processed with the Madhura Oshada in Pitaja Timira. Pipali with the Jangala Mamsa mixed with the Madhu and Levana for Kabaja Timira. Okay. Almost I finished, I think. Let us have a quick conclusion. Okay. I'm going to point out some important points throughout my presentation. After the local ocular application of drug may be absorbed into the eye through the corneal and conjunctival sclera route. As I said earlier, the route of conjunctiva and sclera is important mostly for very hydrophilic and larger molecules that are not able to penetrate through the corneal barriers. The Tarpana drug has inadequate lipophilicity for the corneal absorption. So the conjunctiva sclera are considered to be the important alternative route for the bioactive molecules. In Tarpana, the medicine is penetrating through the sclera and reaching the posterior segment and all. Hence, in total, I can say that Tarpana is the main line of treatment for the posterior segment disorders. This is all about the Netra Kriya Kalpas. Lastly, I can say that the Sarvatmana Netra Belaya Ektam Purvidam Asyanjana Tarpanadi, Distisha Nashta Vivran Jagasta, Tamomayam Jagara Egaroga. So, prevention is better than cure. It is to be in your mind that first you assess the dosha condition of the patient at that particular time. Then you decide whether it is in Amavastha or Pakvavastha. Then you decide the procedures. If it is in Amavastha, you just start the Seka, Astrodhana, Pindi, Bidalaga, appropriate procedure you have to choose. When the Amatwa is reduced from eyes and it is moving on to Nirama Avastha, you can start the Tarpana Anjana Pudapaga procedures accordingly. So by this, I am concluding the session. If you have any doubts, you can free to ask. Thank you, one and all. Stay healthy, stay safe. Okay. Dr. Jasul.
Yeah. Hello, doctor. Thank you. Thank you for your wonderful session. So, yeah, I will unmute all. Yes, if any questions, you can directly ask to Dr. Ashwin. I just unmuted all. Okay. And in chat, we have a question that is about the Ahifena Swarasa. That, no, Doctor, I think it's a specific question that in Sannibada Abhishanda, what's the concept behind using Ahifena Swarasa? That
Regarding Ahifena, hello.
Yeah. Hello, Doctor.
Hello.
Yeah, the question is in Sannibada Abhishanda, what is the concept behind Ahifena Swarasa? Is there any approach there?
Actually, I don't know the
Yeah.
main concept because I got from it's from a compiled text. I just put it in my. I don't know the exact answer.
Okay. That you can refer and tell.
Okay.
Yes. Any other questions? You can directly unmute and ask. So we got good feedbacks, Doctor. Yes, Dr. Hima is asking, thank you. Can you suggest any recommendation for constant tearing of eyes, like a dysfunction of lacrimal gland drainage?
Lacrimal gland drainage. That you can use the avakundana. It's like one procedure. It's a modification of Pindi and all. Okay, there's one avakundana. Chinja Haridra Avagundana. There are tamarind leaves, and along with the Haridra, you can make to a pottery. Then it should be dipped in hot water or the Triphala Kvadha. Then it should be applied over the closed eyelids and the Kaninaga Sandhi region. And you can apply it in little warm. Then you can do some massage and all. Okay, from Kaninaga Sandhi to nasolacrimal duct region, that region. So that is very effective, I think so. It is very common in children and all. Okay, I think it's sufficient. Dr. Hema. Hello.
Hello.
You can ask your doubts.
Hello.
You can ask your doubt, Aarti.
Yes. Sir, actually, what is the appropriate treatment for the starting stage of pterygium? If it is in a starting stage and not touch, means just away from the limbus. Okay, not proper cross the limbus and not reaches up to the cornea. It is in a starting stage. And what is the appropriate treatment for this, sir?
Appropriate treatment, you have to do the Chodana Karma first prior to that treatment. I should prefer in these conditions, Anjana is the best choice for the Arma. You can use the Lekhana Anjana and Mutka Anjana. It's very much effective. You can use Lekhana Anjana, mainly Lekhana Anjanas. And also you can use the Ilamir Koyambu Anjana. It's very much very effective in my clinical practice. Anjali, Aarti?
Ji, sir.
Hope you clear your doubts.
Yes, sir. Yes, sir. Thank you so much, sir.
Okay, thank you.
Hello, sir.
Hello.
It was a very interesting class. Thank you. This is Kamya.
Thank you, Kamya.
Sir, for someone having cataract, centralized cataract, and they are waiting their surgery, because of the eye problems they are getting, the vision problem, they're getting headache regularly, and there is astigmatism. Is she a suitable candidate for regular Anjana application?
first you have to assess the visual acuity once. How much power, how much visual acuity is there? Then only we can decide the Netra Kriya Kalpas. If it is, then you have to examine the lens properly. Is it in mature form or immature cataract is there? Then only, if it is in immature form, we can do the Anjana Karmas regularly. Don't go for the Tarpana and all. You just do the Anjana Karmas. After the Shodhana, you can start the Anjana Karmas. When it is mature in nature, you have to send the patient for the surgery itself. Otherwise, you can do the Anjana Karmas properly. According to dosha, you have to assess the doshas. If it is Vadi association, Paitika association, and Kapha association, accordingly you can decide which what are the medicines suitable for that conditions. Hope it is clear, Kamya.
Yes, thank you, sir. So we can, if nothing is available, we can ask to apply Ilanir Kolumbu if the vision is good.
If the vision is good, if the cataract is in immature form, you can tell the patient to do the Ilanir Kolumbu Anjana after the Shodhana Karma. First you
Okay,
go for
understood.
one Shodhana Karma, then only you do the Anjana Karma.
Thank you, sir.
You can directly apply the Ilanir Kolumbu Anjana directly. Prior to that, the Shodhana is mandatory.
Okay.
Hope it is clear,
Thank
Kamya.
Yes, very clear.
Okay. Any questions?
So Dr. Prachi is asking for floaters according to Ayurveda.
Actually, there's no direct reference of floaters as per Ayurveda. I don't know the exact answer.
Maybe you can refer it. Okay.
Yes, I am also referring that. I'm also trying to get that answer. There's no exact correlation with the modern and Ayurveda. There's no direct correlation.
Dr. Annapurna, you can ask. I think no more questions there. We can wind up this session. It's already late. Okay. Thank you, Dr. Ashwin. And thank you everyone for participating. All the slides and notes are available in this session. You can join the WhatsApp group. Okay. Thank you. Thank you very much.
Thank you so much.